Well, good morning everyone and welcome to today's webinar. Before I start, I just wanted to give a quick overview of our presenters for today. My name is Julia Lyon. I'm the National Project Manager for Agencies for Nutrition Action, and I'm going to be summarising the key points from our recent snapshot on food and beverage marketing to children in New Zealand. I'm thrilled to have Dr. Gabrielle Jenkin, a research fellow from the University of Otago in Wellington, with us today talking about food marketing in New Zealand. Her current research involves an examination of food marketing to children around television and via the internet and the relevant rules and regulations around this. And finally, Dr. Moira Smith is also joining us, another research fellow from the University of Otago in Wellington. Her research interests lie in the area of policy developments which create supportive environments, particularly in nutrition, children's health and oral health. So with the formalities aside, let's jump into the business end of things. Obviously, there are multiple factors that influence our food environment, things like government policies, pricing strategies, social norms, for example. And if we're going to make the healthy choice the easy choice, we need multiple interventions to do this. Research has shown that food and beverage marketing influences children's eating habits, their preferences, requests, choices, and consumption. And food and beverage marketing is definitely a multi-million-dollar business which is evolving along with technology. And one of the biggest issues with food and beverage marketing is obviously the fact that at present it's composed almost entirely of messages which promote the consumption of energy-dense, nutrient-poor food and beverages. Action on reducing food and beverage marketing to children is supported by many organisations, including the World Health Organization and UNICEF, and research back in 2006, which looked at the cost effectiveness of interventions to reduce childhood obesity, found that restrictions on food and beverage marketing were one of the most cost effective things we could do. But unfortunately, despite all of the good evidence and support that there is for reducing food and beverage marketing to children, action in this area in New Zealand has been pretty lacking. So why do we take just a focus on children? We know that preferences and food preferences are developed during childhood. So obviously eating patterns established during this time will have both immediate and long-term implications. Marketers see children as an important target market. They have the power to make purchases not only through their own money, like pocket money, but also the influence that they have on the purchases of their parents. They're also important because positive brand relationships established at childhood can have long-term implications in terms of brand loyalty. So children will be more likely to purchase products that they have had a positive association with as a child. And finally, there are psychological differences between children and adults, which make children more vulnerable to marketing. So children are more likely to accept advertisements at face value, accepting them as truthful, accurate and unbiased. So if we're going to do something about food and beverage marketing, where could we intervene to improve the marketing environment? One of the first points here is around the difference between marketing and advertising, and obviously these two terms tend to be used interchangeably but are quite different. So advertising really is just the tip of the marketing iceberg, and focus on it alone misses other equally powerful marketing tools. Marketing itself includes not just how products are promoted, but the products themselves, their prices, and the places that they are made available. So it's important that any intervention takes into account these other marketing tools. The marketing landscape is also changing. So as marketers find new and more innovative ways of targeting, of reaching children. TV advertising is on the decline, and research from 2012 found that e-marketing now accounts for 1 in 5 advertising dollars, and it's anticipated that that will increase to 1 in 4 by 2016, so change is happening there. Another area of concern is the sponsorship of events and organisations by food and beverage manufacturers that produce products that are predominantly high in fat, sugar and salt, so things like the Olympic Games, for example. Point of sale promotions are also a concern. And finally, while it's commendable that a lot of manufacturers have made pledges to reduce food and beverage marketing to children, unfortunately these pledges tend to differ, and they tend to lack transparent monitoring and clear definition. So what we're asking for is a level playing field that's actually designed to reduce the power of food and beverage marketing to children and their exposure to it. So how could we do this? In terms of policy options, there are three options. Self-regulation, which is where the rules are developed, administered and enforced by industry, and that's the current situation that we have here in New Zealand, and Gabriel's going to talk a bit more about that later. But we know that this model is not reducing the exposure of children to and the power of food and beverage marketing to them. Co-regulation is another option, so that's where rules are set by government and enforced by industry. There are pros and cons of that are listed in the snapshot, but it does reduce some of the conflict of interest inherent in self-regulation. And the finally most strict form of regulation would be government regulation. So that's where the government sets and enforces rules. And the World Health Organization states that this method has the most potential for success in reducing food and beverage marketing. But we also know that that government regulation will receive strong opposition. Another question is, do we focus on just advertising or do we focus on marketing? Again, the bigger picture. Marketing would capture more of the things that influence children's purchases and requests, but would be harder to define. And finally, do we restrict just high fat, sugar, salt food and beverage marketing? Do we restrict all food marketing, or do we restrict all marketing to children, full stop? And certainly some countries have taken that stance. So finally, obviously this is a really brief overview of what is contained in the evidence snapshot. So I encourage you to look at that on the ANA website. But basically, based on the evidence, what we're recommending is that any intervention needs to be comprehensive in design, taking into account the widest range of marketing techniques. We have a lot of marketing, not so much in New Zealand, but definitely globally. There is a lot of marketing research, a lot of research around advertising to children, but not a lot on the other areas of marketing. So that's the way that products are priced for children, the way that where the products are placed, and finally the products themselves. So we need more research in that area. In the snapshot, we're also recommending stepwise action. So we're recommending that we go to co-regulation first. That's more likely to be politically palatable than a jump directly to government regulation. So co-regulation would mean that the government would set the rules and that these would be enforced by industry, but the big thing that we need to ensure is that it is independently monitored. So if co-regulation is not reducing the exposure of children to and the power of food and beverage marketing to children, then government regulation would definitely be warranted. And the final point here, in the snapshot, we recommend that we restrict all food and beverage marketing to children. Healthy food and beverage marketing is almost non-existent at the moment, and by restricting all food and beverage marketing we wouldn't require a system of classification. So that is the main points from the snapshot. I just want to acknowledge the peer reviewers of the snapshot for their input and the members of ANA who have supported the document. These include the Cancer Society, Stroke Foundation, Toi Tangata, formerly known as Tohotu Manawa Māori, the Asian Network, the Heart Foundation, Home Economics Technology Teachers Association of New Zealand, and the Pacific Island Food and Nutrition Action Group. So I am going to now hand the reins over to Gabrielle to share her research.
Okay, good morning. I'm going to talk about food marketing in New Zealand, and I'm going to explore some of the key issues and findings from my research on food marketing in New Zealand. This research focuses on food marketing to children and comes from two studies nearing completion. one on television food advertising and the other on food marketing on 3 internet platforms. As in many similar jurisdictions, New Zealand relies on a self-regulatory model of advertising. The advertising rules by which all media comply are set by the industry-funded Advertising Standards Authority and outlined in a number of advertising codes, 2 of which are relevant to food, or to food advertising to children. Also relevant when we're thinking about television advertising and self-regulation are the New Zealand Television Broadcasters Code, which is known as Getting It Right for Children. And this covers the main free-to-air broadcasters. Under these codes, only food considered as healthy can be advertised during children's viewing times. And according to the ASA, children are defined as children under 14, and the definition of children's viewing times are defined by the individual television broadcasters. The study that we designed to look at food marketing on television was aimed to see whether self-regulation of television food advertising in New Zealand limited children's exposure to unhealthy food marketing. And what we did was we recorded 3 days, that's mornings, afternoons and evenings, of television viewing on 5 different channels, TV2, TV3, Māori TV, and 2 channels from Sky that are popular with children, Nickelodeon and Cartoon Network. So we looked at the number of food advertisements on these channels during these times, and we looked at broadcaster definitions of children's viewing times, and we looked at actual viewing times of these children on the basis of Nielsen data on children's viewing patterns for children aged 5 to 17. Okay, the key findings. What we found was that there was no unhealthy food marketed on the 2 pay TV channels that we looked at, Nickelodeon and Cartoon Network. Although the fast food brands, such as McDonald's and Burger King, were featured, the foods that they were promoting were the healthier versions of their menus. For the free-to-air television channels, TV2 and TV3, which are the 2 channels most often viewed by children, there was a lot of unhealthy food marketing, mainly in the afternoons and into the evenings. Probably the key finding from the study is that for the free-to-air television channels, TV2 and TV3 in particular, there is a complete mismatch between what broadcasters define as children's viewing times and when children actually watch TV. And this shows the data, and it illustrates, if you look at the, can you see that? If I, oh whoops. If you see there's the 2 grey bars in the top graph, which is for television 2, and the bottom graph is for television 3. The 2 grey bars represent where the restrictions according to the broadcasters apply, and the black line that goes right through that is showing when children actually are watching television. So you can see that the broadcaster definitions of children's viewing times are not a good fit with when children are actually watching television. And the peak time for children watching television is around 7 and 8 p.m. in the evening. So basically they're watching television early in the morning before school, and then from 3 p.m. in the afternoon it increases until about 7 p.m. in the evening, and then starts to decline again. So if we were to have if we were to try and limit children's exposure to unhealthy food advertising, the restrictions would have to apply throughout the evening.